Good evening. Late this afternoon, the FDA's Vaccine Advisory Committee actually voted overwhelmingly in favor of updating the vaccines to include an Omicron component.
But they also debated the bigger issue of how to better prepare for what may be ahead, especially as we head back into fall. Our Dr. Frank McGeorge has been following their discussion closely, and he joins us with a closer look at how this could impact all of us. Doc?
Well, you know, Karen and Jason, we are at a much different place in the pandemic than we were when the vaccines were first created. Basically, we've always been a step behind because while scientists were testing the vaccines, new variants were emerging. Well, today, experts tried to decide the best way to close that gap and anticipate what the virus could do next.
Our goal today is to try to address a situation that we are concerned about in the fall.
Dr. Peter Marks from the FDA warning of a collision course.
That combination of waning immunity combined with the potential emergence of novel variants during a time this winter when we will move inside as a population increases our risk of a major COVID-19 outbreak.
Health officials believe a booster campaign may be needed this fall, but the timing will be tricky.
All the models are showing similar sized peaks for sort of their most likely trajectory for hospitalizations, but the timing of those peaks differs substantially.
We're being asked more or less to have a crystal ball today.
Moderna and Pfizer presented data on updated boosters.
Pending authorization, large-scale supply of a bivalent Omicron-containing vaccine could be available in late July and early August.
EUA requirements were met for a vaccine update, and we can supply an Omicron BA-modified vaccine now.
Because the original vaccines have been so successful at reducing the risk of hospitalizations and deaths, the World Health Organization recommended adding an Omicron strain, not replacing the original virus strain.
We're not trying to match what may circulate. We're trying to increase the breadth of the immune response without losing the benefit from the index vaccine that's performed so well.
Now, Pfizer and Moderna have already been producing updated vaccines that contain the first Omicron strain, BA.1. Those boosters could be ready very quickly. However, if the FDA decides to pick BA.4 or BA.5 instead, the Omicron strains that are currently circulating, the manufacturers would actually need about 3 more months to produce those boosters.
And Doc, I'm sure you're waiting for this question. If you haven't gotten a booster yet, should people just now wait for the new version?
Well, you know, it really depends on several factors. If you recently had Omicron, then it makes good sense to just wait for the new booster. But if you're at a high risk and you have not been boosted, waiting for the new booster probably isn't going to do you any good if you get COVID in the meantime. So ultimately, I think that is really a conversation that people just need to have with their own doctor to take your personal risk and benefit into account.
Good point. Could very well be a gamble. All right, Doc, we appreciate it. Now let's take a look at COVID numbers for the week. The state reporting 14,353 cases over the past 7 days, which is an average of about 2,000 cases a day. And this is up from last week. The state is also reporting 174 new deaths over that same 7-day period.